I'm David Lombardo, and this is WCNY's The Capitol Press Room, and we're exploring the flow of state dollars for long-term care and considering a critique that the rate setting by managed long-term care plans is not being properly prioritized. For more on these concerns, we're joined by State Senate Aging Committee Chair Cordell Cleare, a Harlem area Democrat. Thanks for making the time, Senator.
Thank you. Thank you for having me.
And we're also joined by Dan Savitt, CEO of VNS Health, which offers a variety of health services in the New York City area, including home care and hospice care. Thanks for joining us, Dan.
Thank you for having me.
So the concerns that have been raised are essentially that Medicaid dollars are disproportionately going to services for New Yorkers with minimal care compared to those New Yorkers with more intensive medical needs. What is it about the status quo, Dan, that has led to this dynamic, and is it a recent phenomenon?
Rate setting for health plans is inherently complex at times, and you need to get it right. And so what happened in the most current fiscal year is as there are changes in policy, you need to match the changes in the way you finance it. And the flow of funds essentially, right, from the state, from taxpayers, right, to the state, to the plans, and then out. And this from the state to the plans is where it gets complicated, and where in this case things got sideways. And so if you think about, not every plan takes care of the same level of folks. So some plans take care of the healthier side of those that need long-term support services, and some plans like ours takes care of those that are most vulnerable, people with disabilities, people on ventilators, people homebound and bedbound, those kinds of things. If you don't get the math right and the calculations right from the state to the health plans, you get an imbalance. And this year, this current fiscal year, and this new fiscal year that's still being debated, got it wrong. And so basically the math associated with moving the money from the state to the plans got things wrong, and moved dollars from those folks, those New Yorkers who need the care the most and cost the most. Those funds flowed over to those that maybe need less services. Maybe they need toileting help and help with groceries and those kinds of things. But that's a far different situation than if I'm at home, homebound with COPD and so on and so forth, which is who we take care of.
Well, what are the consequences of the funding scenarios that you just laid out, Dan? What does that mean for a provider like yourself that's going to be theoretically doing more intensive care?
Yeah, so as the largest, highest quality statewide health plan, what this means is people are at risk to getting their care. So there's not enough money for those, right? And so essentially our health plan side, so just to back up, we are a statewide not-for-profit. We are been 133 years doing this work for the most vulnerable New Yorkers, both in the city of New York and across the state of New York. And we have the most, what I would call it, experience in helping people with these very complex challenges. And so we're at risk of no longer being able to offer these services. And therefore, the people we care for, their families, right, their loved ones, are at risk of losing an essential connection to getting them what they need in the home and in the community. So it's a pretty big risk, I believe, for the state to be moving money from A to B.
The consequence of them not getting service at VNS is that a lot of people are going to wind up in nursing homes and hospitals, where unquestionably the state will spend more money. And we could avoid that by allowing people who have done this, as Dan mentioned, over 130 years of service. They are familiar. They have done this kind of work. And there's no, if they leave VNS, there's no one else to take them. So that would be really tragic.
Well, Senator, what is the appropriate response to this dynamic? Is it changing the financing formulas, or do we need to do some sort of short-term intervention in terms of adding more cash to the available funding for these services?
The solution definitely is two things. We have to reform the way the dollars are prioritized, and we also have to stabilize VNS Now, we have to make sure that, they're whole and they're able to continue the work that they've been doing that so many people critically depend on. And we also have to figure out a way to reward organizations like VNS that are doing this high acuity work. All the other things are necessary with for all of that. I'm happy that people are getting assisted in other ways, but this very, very high need, these high need situations, long-term high need situations, we really need to get those people cared for, people who are bedbound, people with severe physical disabilities, individuals requiring ventilators, as was mentioned, or 24-hour care. People are managing multiple chronic conditions. These are the kinds of cases that VNS, takes care of. And we can't afford to lose that kind of service. We have to make sure that we're supporting them so they can do this kind of work.
Well, before we move on, let me reintroduce both of you for listeners. I'm David Lombardo, and this is WCNY's The Capitol Press Room, and we're speaking with State Senate Aging Committee Chair Cordell Cleare, a Harlem area Democrat, and Dan Savitt, CEO of VNS Health, which offers a range of healthcare services in the New York City area. Well, Senator, do you think that the landscape we have now is the result of unintended consequences, or do you think this is the outcome that health officials were looking for when they set down this framework for financing, that there was a rationale for this dynamic?
Yeah, I think it is an unintended consequence, and I think we need to address it immediately. We have to take another look at it. I think everything was good intention, but sometimes things don't work out quite the way we intend because we don't factor in all these kinds of possibilities that other groups would, they race to sign up people with the lowest amount of need, and all the money's gone. And there's not enough money for people with high acuity needs. So we have to balance it is what we have to do. Sometimes we got to go back and rejigger things. And that's what I think is necessary right here while we also work to fund them to the level of stability.
Well, Dan, I can't imagine VNS Health is sitting on its hands throughout this experience. So what has been the feedback you've gotten from state health or budget officials about the status quo?
Yeah, well, I appreciate that question. I appreciate what Senator Cleare said, everything that she said about the need to focus on how we make sure the funds, the taxpayer dollars, get to the people that need it the most. And what I would say is generally, folks know who we are. Many people have, we serve, for example, 6,000 people in Senator Cleare's district. We have a high number of employees who live in our district as well. And so what we get is a lot of very positive feedback on who we are and what we do. And it's important that you as an organization continue to survive and serve across the state of New York. That doesn't fix the fundamental math problem that we have. And so what we need to move from is we recognize the great work you do. It's important that you're still here. And we want to help you do that to here's your stopgap for right now, and then we're committed to and going to fix the math problem to ensure the money gets where it needs to go. And I would just underscore what Senator Cleare is saying, which is like where you put the money, how you finance healthcare needs to match your policy goals. Sometimes those things get sideways, and this is healthcare is very complex, especially for people who are aging and have a lot of complex issues. And but there needs to be a recognition it's we got it wrong and that we need to fix it. Otherwise, you have a lot of for-profit going after the areas of profitability and can cause a lot of harm. It can cause a lot of harm from a budget standpoint where we're spending too much money and cause a lot of harm in that we've taken money away from those that need it the most. So those people end up not getting the care they need. And so there's in my mind, there's plenty of money in the system. Let's just make sure we get the financing matching the policy goals.
When you do bring this up, though, to state officials, do they say, oh, wow, I didn't even think about this? Or do they say, yeah, there's a reason why we're doing this and we're not changing it?
It's kind of in between. Like it's thank you for pointing it out. We see what you're talking about. We recognize that this is problematic, and there are certain things that we can't do right now, or we have to go through the standard process, or we rely on this third party to do the calculations for us. So it's a little bit different tenor than we have heard in the past from the State Department of Health. Because, in honesty, I've been in this role for or with this organization for over 8 years now, and each so it's like my ninth budget, and each budget some things get right and some things are not right. And generally, there's been a pretty quick recognition and willingness to get it fixed before the next fiscal year. And, my honest assessment here, which is why we've so thankful for Senator Cleare, is they're not moving at a speed by which we feel confident that there's a desire to fix it.
Yeah, and I'd say, fortunately, we have an opportunity right now to pivot and have a course of correction in favor of rewarding organizations like VNS and plans that focus on individuals with the most need. I mean, if we've gotten to the point where we are punishing those like VNS Health who care for those who need it the most, letting them go into the red and incur deficits for doing the right thing, then we've lost our way. That was not the intention. And, that's the spirit behind a bill that I carry with Assembly Health Committee Chair Amy Paulin called the Managed Long-Term Care High Acuity Stabilization Pool. And, the key points is to put an immediate infusion of money into it to help save the high acuity MLTC plans. We need them. We absolutely need those plans. DOH would stay in control. We want them to stay in control. Unspent funds would revert back to the state. It would be structured to allow for a federal match. So there are things that we can do. And, some things sometimes they get bottlenecked in bureaucracies and whatever have you. And, we're going to do everything that we can to move this along because it's too important and we can't take our time. We need to enact this bill. The final state budget must include funding for VNS Health to make sure that the MLTC financing reflects the needs of people who have the greatest needs. We're talking about real people. This is not just numbers on paper. This is not bureaucracies, bureaucrats. This is not memos. This is real people, real lives that are being impacted. And they are at the greatest need, the most vulnerable. And it's only going to become due to the fact that, so many people are living longer. This is not something that we can afford to kick the can down the road on. Our older New Yorkers are the fastest growing population. And I mean, not that this only applies to older folks, but many of their clientele are older people, but, there are also others with developmental disabilities and so forth. But we need this. We need this now. And it literally is a matter of life and death.
I appreciate that. I think, we care for 7,000 people with disabilities in addition to thousands of other folks with really big needs. And if you think about it, it's not just the people in our community, it's your mom, right? It's your loved one. Yes. And so anyone who's ever, and many of us are caring for our parents right now and understand how difficult it is, even when the needs aren't great. But if you can imagine what happens to folks as needs get great and they're homebound, and how difficult and the strain that is for not just the individual themselves, but their family, their loved ones, their neighbors. And I think it's important to recognize that many of us in healthcare that serve the kind of New Yorkers we do, those with the real needs, as we've been talking about, significant amount of needs and complexities, is that we're usually the local plan, like the local or regional, I call them regional plans or local providers. We are the largest home health organization, large home care. So we touch, we're out in the communities every day. And when we ignore these financing issues and the money streams, in this case, to maybe those organizations that are large national organizations, you lose that the people running those organizations, the people answering phone calls, the care managers, you lose that local flavor. So my teams are all New Yorkers almost. They're almost all New York, some New Jersey, some Connecticut, right? But mostly New Yorkers. And it's their neighborhoods, their neighbors that they're taking care of. And so if we don't address these big financing uh, issues that when they come up, now you're losing uh, all this passion and compassion that you have for the people you serve and allowing others from out of state and out of the country to try to do this work. And I just don't think they're ready to do that and committed to do that like we are.
Just to be clear, though, VNS Health is not some mom and pop operation, though, right? I mean, you're
Mm-mm.
one of the largest healthcare agencies focusing on nonprofit home services in like the country,
Yes.
right?
Yeah, but only in the state of New York.
Sure, but it's
Yeah.
it's not
Yeah,
small.
we're not small.
Okay.
We're not small, which,
No, it's
but
not small at all. Serving over 150,000
Mm.
people.
Yeah,
yeah,
That's more than some other places
yeah,
combined.
appreciate the comment, David. I guess my point is we all live here.
mm,
So yes, we're
Right.
large and we have a lot of people working with 12,000 employees, but they're New Yorkers and they're serving New Yorkers and they understand the complexities of living in New York and you feel much more tied to the communities that you're serving when you live here and do this work. And so, we don't want New York to lose that. And I certainly don't want to see that happen.
Well, if state policymakers do decide to take a look at the managed long-term care funding formula, so to speak, or set up some sort of stabilization pool, as the senator has proposed, I'm curious, Dan, whether you would be okay with other, say, accountability strings being attached to it, whether it's some sort of increased scrutiny as it pertains to our Medicaid dollars, so we have a better sense of where things are being spent and that it's actually being spent on intensive patient care, or other accountability measures. Would that be something that you would be open to in this conversation?
Absolutely, 100%. So we are both payer and provider. We have a health plan and we have provider services. And in all ways, we want to be the highest quality, most open and honest organization. And I think healthcare needs that accountability. And we see it in pockets, but I would say as a system, we've got to be much more transparent on where that money is going, who it's going to, and ultimately then what are the outcomes, right? Are we reducing the number of visits to the ED in the hospital? Are we reducing the number of falls? Are we improving mortality rate? Are we living longer, healthier, so on and so forth? And yes, we should be paying. This is one of my pleas is that, we're highest quality because we care about quality. There's no money tied to the MLTC quality today, even though we are the highest quality. We're not going to stop doing that work. We think that payment should be tied to very transparent and important quality measures that get audited and so on and so forth. So yes, absolutely 100%. We would welcome it across the industry.
Well, we've been speaking with State Senate Aging Committee Chair Cordell Cleare. She's a Harlem area Democrat. Thanks for making the time, Senator.
Thank you.
And we've also been hearing from Dan Savitt, CEO of VNS Health. Thank you, Dan.
Thank you very much. I appreciate it.
Support for the Capitol Press Room is provided in part by the Lawsuit Reform Alliance of New York. Fraud and lawsuit abuse impact car insurance costs for New Yorkers. Reforms are being proposed to mitigate their impact. Information on these reforms is available at keepnewyorkaffordable.org.